Good evening, everyone. Thank you for joining us here tonight. It's a pleasure to welcome you to the Baker Institute, both to some familiar faces and some faces that we haven't seen before. It's really an honor to have Roberta Ness come speak with us tonight. She is truly one of Houston's most outstanding individuals, both in terms of scholarly accomplishments and as a leader for our community. And many of you probably know Roberta Ness is the Dean of the UT School of Public Health. She received her MD from Cornell University and her Master's in Public Health from Columbia University. And she's a recognized expert in women's health research and has pioneered the research paradigm of gender-based biology. And through her work, she's known for her 1999 book on health and disease among women, published by Oxford University Press. And also because of this research, in 2008, she was named as the Distinguished Professor of Women's Health by the Society of General Internal Medicine. Roberta Ness is also a member of the Institute of Medicine of the National Academies. She is a fellow of the American College of Physicians, the past president of the American College of Epidemiology, and the president-elect of the American Epidemiological Society. And in 2011, Dr. Ness was named the Vice President for Innovation at the University of Texas Health Science Center at Houston, which brings us to the topic of tonight's event, where Dr. Ness is going to be speaking with us about her book, Innovation Generation. And I won't be introducing the book because I'm sure you're going to do a much better job of explaining things to the audience. And thank you so much for agreeing to come speak with us about this tonight.
Well, it's a terrific pleasure to be here tonight, and I'd like to thank the Baker Institute very much for inviting me, and thanks particularly to Vivian Ho for organizing this. Thanks to the folks who came out from the School of Public Health, in particular our student ambassadors who are sitting here in the front row. And so if you want to know anything about the School of Public Health afterwards, you can certainly ask them as well. So I've come to you tonight with a question, and actually my first question is, how innovative do you think you are? So if we were to construct a high-rise in which, there's a penthouse at the top and there's a sub-basement at the bottom, where do you think you would, what floor would you be residing on in terms of your own innovativeness and your practice of innovation? And to really answer that question, of course, you have to know how I'm defining innovation, right? And so I'm going to first tell you what's kind of a standard traditional definition, which is creativity with a use. But I'd also like to tell you that I think a more helpful definition, a more quantifiable definition, is surprise in the service of health and prosperity, which is, I think, what science is trying to achieve. And the reason why I say that it's more quantifiable is because typically, and interestingly, your surprise and my surprise are pretty much the same thing. But let's go back to the question of how innovative you think you are. So I don't need you to shout out any answers. Just think about that for a second. And now I'm going to go to a second question, which is, how innovative do you want to be? Okay, so now if it turns out that the answer to the first question and the second question are not the same, if you're not residing on the same floor of that high rise with a flashing sign on the top that says innovation, then you kind of have to ask yourself, well, why is that? Why am I not practicing how innovative I want to be? And typically, the answer to that, my colleagues tell me, is because most people think that innovation or creativity is temperamental, which is to say you have it or you don't, or perhaps you get it in some great insight, which is divine. But what I'm going to tell you today is that neither of those things are true. They're true to some degree, perhaps, but on the whole, innovation can be taught. And so that's what we're going to be talking about today. And it turns out that there's 30 years of research that really proves that innovation can be taught. And most recently, there was a meta-analysis, so a big analysis of lots of different studies, about 70 evaluation studies that had all evaluated creativity training programs, and it showed that with training, people can improve their scores on standardized tests of creativity, which of course sounds like an oxymoron, but there are actually these tests where you get asked things like, think of all the different ways you can use a brick. It's kind of interesting. But people can improve their scores two to threefold on these tests with creativity training. Not only that, but these increases are independent of age, so they occur at every age. They occur independent of gender, they occur independent of profession, and interestingly enough, they occur independent of intelligence. So, as you just heard, I'm the dean at the University of Texas School of Public Health. And despite the fact that I'm a scientist, and science, moves on the basis of creativity, innovation is the engine of science, nonetheless, I never took a class in creative thinking or in innovative thinking. But about 10 years ago, I had a boss, and one day he brought me into his office and he said, so Roberta, you're doing a great job. You're getting lots of grants, you're publishing lots and lots of papers, that's really good. But I really wonder if you're moving the needle, if you're actually taking the risks needed to leap science forward. So some people, when they hear that story, they say, wow, that was really nice that he took, such a personal interest in you. My own experience from that, my own reaction to that was I was completely pissed off. But after I got over that, I realized that part of my reaction was actually that I was fearful. And the reason why I was fearful is because what he was really asking me to do is he was asking me to move from a place where I was very comfortably doing what everybody was telling me to do to a place where I was going to be putting forward crazy ideas that could get me potentially laughed out of my profession. But nonetheless, it started me into what I call my summer projects. And these were fairly crazy ideas that I published. The last of which is this book, Innovation Generation, which I'm going to be reading a little bit from today. But most of them were science questions, and they were an opportunity to really kind of look at things in a different way, and I'm going to describe one of them to you at the end of this talk. But what these summer projects really taught me more than anything else is they taught me that I was perfectly capable of innovating, of thinking in a very different way, but I had not done it before because, again, I was really afraid to use this ability, and I wonder how much of that is also affecting you. So, whoops, let's see if this will work. Okay, there we go. So this is the cover of Newsweek magazine, July of 2010, and when you turn to the story inside, it was entitled The Creativity Crisis. Why? Because what it documented was that for the last 2 decades, students in this country have been gaining IQ points every year. Our students have been getting smarter and smarter, but they've been losing points every year on these standardized tests of creativity. So does that mean that our students are getting less and less creative? Well, at about the same time, the National Academies of Science commissioned 2 special reports called The Gathering Storm. And what those reports said is that they said that we in America are actually losing our edge on innovation and progress in science as compared to the rest of the world. And that, they believed, in part was because we are losing what they called our creative ecosystem. Now, at this point, some of you are probably thinking appropriately, now wait a minute, hold the phone. I read the newspaper every morning, and technology is just rocketing forward, plus the fact that every time I take out my cell phone, my iPad, whatever it is, I see this tremendous increase in science and innovation and inventiveness. What are you talking about? But what I would argue is, and many other pundits have argued this as well, is that when you look at the major threats to humanity today, global warming, emerging infectious diseases, obesity, Alzheimer's disease, cancer, science is making very slow progress in overcoming those problems. And I worry that that may be for lack of inventiveness and imagination. So I just want to read you the beginning of this book, and I just realized I don't have my glasses. Who has my glasses? Whoever has my purse has my glasses. Thank you. I can't read anything in this light. Thanks. It's in my purse, actually. Thanks. Okay, so again, I'm going to read you the first page or so of the book. The symptoms come on suddenly. Your eye sockets ache and your temperature races the mercury up the thermometer. You are overcome by a sense of lethargy so profound you cannot raise your head from the bed. Others with the sickness have no choice but to go to work, but you cannot imagine undertaking such a heroic effort. In a few days or a week, you may be fine, but you may instead be one of the unlucky ones. The disease may club you down with great speed and force. Tiny purplish spots begin to erupt over your face, chest, and abdomen where capillaries can no longer hold their contents. You vomit blood. You cough blood. Suffocation advances as your own bodily fluids flood your lungs. Within hours or days, you have lost all hope. Such was pandemic influenza. In 2009, the world held its collective breath as the same strain that had killed between 50 and 100 million people in 1918 reemerged. 1/3 of all humanity were brought low in the 1918 flu. Young adults in the prime of their lives were destroyed in such vast numbers that graves had to be dug by bulldozers. Imagine a disease that in modern terms would equate to illness among 2.2 billion people and death amongst 220 million, a death toll equal to 2/3 of the entire US population. Nothing could be done to stop influenza's advance in the spring of 2009. After sickening 60% of the town of Veracruz, Mexico, it began to sweep through the US, taking its first victims in Texas and California. To prevent further spread, the European Union took the dramatic step of warning travelers to avoid all non-urgent trips to Mexico and the United States, but it was too late. The next day, influenza was reported in Israel, New Zealand, and Spain. A century and a half earlier, two innovative geniuses, Robert Koch and Louis Pasteur, revolutionized science by discovering that specific diseases are caused by single germs. With the inspired creation of a vaccine for rabies, Pasteur gave mankind a fighting chance against infectious diseases. Ever since, the first best hope for containing a viral epidemic like H1N1 had been to develop a vaccine. But although the entire genome of the 1918 flu was published in 2005, the archaic manufacturing process for any new vaccine, which involves weakening the virus then growing it in hen's eggs, has not changed since the time of your father and your grandfather. H1N1 was free to run rampant around the globe for 39 weeks in 2009, awaiting a vaccine. Fortunately, the scourge was more benevolent than anyone had dared to hope. Although 200 countries were affected, fewer than 12,000 people died. But will we be as lucky next time? For the world to be safe from the next influenza outbreak requires innovation. Imagine you could scan the new strain's genome in a day, reassemble an attenuated viral genome base pair by base pair in a week, and grow billions of clones in a month. Science is working on inventive solutions, but will these be ready before the next pandemic hits? So that's our problem. So the point of that is, and the difference, I think, between your cell phone or your iPad and what I'm talking about, is that that kind of innovation is big innovation. It's big surprise in the service of health and prosperity. It's transformative. It's the kind of work that Bell Labs did when they were developing transistors and integrated circuits and lasers. It's not the kind of work, frankly, that Steve Jobs did in developing an iPad with apps on it. So we love innovation, actually, and we desire it tremendously. If you Google the word innovation, you get 250 million hits. And if you ask CEOs of major American companies what is the most important asset in their workforce, guess what they tell you? Right. Nobody had to say it. So But the problem, it seems, is that we have a demand and supply problem, right? There are lots and lots of people out there who have the ability to innovate, but in fact, for whatever reason, they don't feel that they're using it to its maximum effect. So I'm going to give you a quick peek today into a course that I teach called Innovative Thinking, and which is described in this book. And the main concept in this course is something called frames. And frames define, went too fast, define our thinking. They define our thinking. They are the set of expectations that we use to interpret new information. I'm going to say that again because it's really important. They're the set of expectations that we use to interpret new information. Well, what does that mean? So you go to a restaurant and you order a plate of pasta and you're brought this very nice steaming linguine, and the waitress sets it down and smiles at you, and you say very politely, "Would you mind bringing some cheese?" And she nods and says, "Go to the kitchen and get it yourself." Right? So that's not what you were expecting. That is defined as a frame break. And it it demonstrates two things about frames. One is frames are ubiquitous. So in any social context, you have lots and lots of frames working. Right here, as we sit, you have a whole multitude of frames, a whole multitude of expectations. If the person sitting next to you were to grab your sleeve and wipe their nose on it, you would be surprised, right? That would not be within your normal frames. And we know who you are. Just want to say that. So the other thing about frames is that they are not only cognitive, they are emotional. So again, the example of go to the kitchen and get it yourself, or the person sitting next to you wiping their nose on your sleeve, that does not just generate some cognitive response where you say, that's interesting, let me think about it. You have a visceral reaction to that, right? And it's really a visceral rejection reaction. And so the fact of the matter is, what just happened? When you break a frame, you were surprised, right? Surprise in the service of health and prosperity is the definition of innovation. And to innovate, you must, especially big innovation, you must break frames. The fact that we have an emotional reaction to our frames means that in that frame breaking, you're doing something that is non-normative. And in fact, it is unnatural, and it takes bravery, and it takes practice to do it. So now every good class has a test, right? And so it's time for our test. I'm just going to throw out a couple numbers here, ask you to multiply them in your head. 286 times 592. First person who gets the answer, just raise your hand, please. No, I'm kidding. That's not really the test. The test is this.
Gary
I want you to
and
solve
Nancy
this
are
mystery.
lying dead on the floor. Around them is a puddle of water and some shards of broken glass. What were the circumstances of their death?
Okay, so probably at this point you're thinking caution tape, you're seeing those outlines of the body in chalk, the two bodies in chalk, CSI, right? Gary and Nancy, you're not really sure. What's the easiest answer to this problem? The easiest answer is that Gary and Nancy are fish, and their fishbowl broke. Gary and Nancy are lying dead on the floor with some shards of glass and some water, right? Now, why did you not jump to that solution? The reason why you didn't jump to that solution is because I framed it for you. I framed it by giving Gary and Nancy names, and names imply humanity, so you don't jump to the conclusion that Gary and Nancy are fish. So, humor actually turns out to be the highest form of innovation. And I'm going to explain to you why in a moment. But before I explain to you why, I'm just going to have a little fun by reading to you a few little, these are called demotivators. Anybody ever heard of demotivators? They're great. You find them on calendars. They're a lot of fun. They're basically word definitions, so I'll read a few of them for you. Blogging. Never before have so many people with so little to say said so much to so few. Corruption. I want less corruption. or more opportunity to participate in it. Despair. It's always darkest before it goes pitch black. Perseverance, the courage to ignore the obvious wisdom of turning back. And my favorite, being a dean, planning. Much work needs to be done before we can announce our total failure to make any progress. That is so dean-like. Okay, so why are jokes funny? No one knows why, but systems scientist Donald Burke thinks it's because of evolution. His explanation is that humans have developed uncontrolled reactions to threats. An infection threatens your lungs and causes sneezing or coughing. A counterfactual, so a frame break, threatens your normal pattern of thought and causes laughing. So humor is to a logicality as sneezing is to getting a virus up your nose. This explanation may make you feel better about laughing when you see people jumping into shallow pools or slapping each other around. It may also rationalize why people sometimes inappropriately begin to laugh upon seeing a loved one hurt themselves. Such inappropriate reactions might all result from your innate response to frame breaks. Okay, so I think, hopefully, I've now established that frames are actually difficult to break. And so in order to do that, I'm going to give you some tools that are described in the book. The first tool is observation. So what I want you to do is I want you to close your eyes for a second. I mean, I seriously want you to close your eyes. And I want you to imagine the face of your cell phone. Those of you who are not closing your eyes are cheating. I just want to say that. Imagine the face of your cell phone. And specifically, I want you to put every number and every letter where it goes, or if you have apps on your cell phone, think about every single app and exactly where that goes, right? Okay, so open your eyes. Now, how many of you got that, think that you got that completely right? You got every single letter, every symbol, every number, every app. You got it totally, you knew exactly. That was snap. Almost no one, right? So I can't do that either. The reason is that there is simply too much information coming at our senses at any given point to actually process it all. So we get very complacent about things that we see all the time. What we do, however, is we pay attention to things that we're expecting. So we actually pay attention on the basis of our frames. And a classic example of this is Warren and Marshall winning the Nobel Prize for discovering the relationship between Helicobacter pylori and stomach ulcers. So Robin Warren was a backwoods pathologist in Perth, Australia. He was working at a community hospital. And he started noticing when he was looking at slides from stomach biopsies of patients with peptic ulcer disease, that these slides, these biopsies, there were little dots within these ulcer tissue. And he figured, oh, well, obviously there's something wrong with my staining technique. And so he tried to fix it. He tried to make it go away, and it didn't. So then he started paying attention to these little specks. And he realized that they were there in like half of all the biopsy tissues that he was looking at. Now, he hooked up with a young gastroenterologist, just recently trained, named Barry Marshall. And between the two of them, they hypothesized that these were actually bacteria. And they were ostracized. They couldn't get their abstracts into meetings. They couldn't get their papers published. Nobody believed them. Ultimately, Marshall actually drank a petri dish full of Helicobacter pylori to prove that this caused ulcers, and then he allowed himself to be endoscoped to prove that, in fact, what he had was an ulcer. Today, we know that Helicobacter pylori is a major cause of stomach ulcers, and we know that it can be readily treated with antibiotics, and this was a huge breakthrough in science. But the question for us is, why were Warren and Marshall the only ones, really Warren, to have seen these things when no one else did? He wasn't using any special stains. He wasn't using any special microscopy equipment. He was just a regular, good old clinical pathologist, and yet he saw it and everyone else didn't. Why did no one else see it? It was right there in front of their eyes. And I would posit the reason why no one else saw it is because it couldn't be there. because the frame at the time was actually that bacteria could not grow in the low pH environment of the stomach. So there couldn't be bacteria there, so no one else saw them there. So a second tool is reversal. So Darwin, of course, came up with the theory of evolution by natural selection. The frame at the time, of course, was creationism. So the notion of creationism was that God creates all creatures to perfection. And Darwin flipped that. He literally said, no, actually, that's not what happens. What happens is that Mother Nature could not care less what beauties or, in fact, what monsters she creates and throws into the environment to compete for survival. My favorite reversal is the difference between medicine and public health. So medicine is the presence of disease, and public health is the absence of disease. If you're having a heart attack, you will do anything to stop that heart attack. You will actually allow some stranger that you've never met before to crack open your chest, right? That's what cardiovascular surgeons, cardiothoracic surgeons do. At the same time, that same person may have been unwilling to take the antihypertensives or statins, cholesterol-lowering drugs that would have prevented the heart attack. This is what I call obliviousness to absence, right? It's a reversal. So Darwin also used another tool, which is called change your point of view. He wondered, how can one characteristic in a species compete against other characteristics in the environment? And to do that, if you carefully read On Origin of Species, which of course was his classic tome, he actually imagined himself as a plant. So he put himself into the environment that a plant would be in that process of natural selection, and that was part of how he worked it out. So a fourth tool is analogies. An analogy is a very, very common tool used by scientists. It's used by almost all scientists. And it's very common, it's very easy for us, because the way that the human mind works is that we make associations. And when we make those webs of associations, and those associations are very broad and they overlap, at the overlap is the point of an analogy. So examples of how analogies have been used recently in science are, for instance, new semiconductor chips have been designed on the basis of the child's toy Etch-a-Sketch. And new FedEx and UPS shipping patterns have been designed on the basis of the swarming behavior of ants. So in the classroom, we hone our skills in analogy making by asking questions like, how is a marriage like a matchbox? So let's see what my students said. We can get this to work.
They spark, they strike each other. Not that we want to.
How is a dream like a dryer?
You forget about it, it can shrink or get ruined.
How is history like a mango?
Both can be altered to suit your purposes.
Okay, another tool is expansion. So I'm going to read you an example of expansion, the last reading from the book. In the 1950s, ocean-going freighters were becoming increasingly costly to operate, so much so that shrinking profit margins threatened the industry's very existence. The shipping industry made a series of attempts to reduce costs in addressing the question, how do we make ships more economical at sea as they transport goods? They built faster ships that used less fuel and employed smaller and more efficient crews. Still, costs remained non-competitive. Finally, in desperation, the Industry Association hired a consultant who broadened the perspective beyond asking, how do we make ships more economical at sea, and enlarged the question to become, how might the shipping industry reduce costs? Bigger question. When put this way, the answer became obvious. Unlike many other industries where personnel are the primary cost driver, in shipping, the largest sunk cost is the ship itself. So any time a ship is not traveling means a major erosion of profit margins. Thus, the solution became to reduce ship time at dock. Historically, ships languished at shore awaiting cargo, and cargo piled up at dock at risk of theft. Within the new framework, ships needed to be packed before they arrived at port. Container technology does just that. By delivering already packed goods, containers reduce port time, theft in port, and costs by 60%. Reframing the question from economies at sea to the more general one of overall reduction of cost provided the insight that saved the global shipping industry. So the last tool that I just want to mention to you is the power of groups. So for a long time, we've known in science, and we've really used multidisciplinary teams to do science, and there's actually good data to suggest that papers that are published by multidisciplinary teams are more beneficial, they're more frequently cited, for instance. But it wasn't until very recently that a scientist actually studied this phenomenon and, in a sense, proved that groups are actually smarter than individuals in many cases. So what was done was that groups were set to doing intelligence tasks. So the same kind of tasks that you would do on an IQ test were set to a group. And what was found was very interesting. What was found was that the average intelligence of the group did not predict the group intelligence. So the aggregate intelligence did not actually predict the group intelligence. What did predict the group intelligence was actually inclusiveness. So the more the group was using all of its participants to good effect, the smarter the group was. And it was something that was called the C factor. So now I'm going to go back to something that I talked about at the very beginning. I told you that I was going to tell a little story about one of my own summer projects. And the reason why I left this until the end was because I wanted to play a little game with you and see if you could find some of the tools in this story. So this is a story about ovarian cancer. And I got interested in ovarian cancer because of some patients that I saw when I was a practicing clinician. And because it's a really, really devastating disease. So just to give you a sense of how devastating this disease is, I used to participate every year in a walk to raise funds for ovarian cancer research. And the first year I walked, there were 10 women with this disease that were walking with me. By the 5th year I walked, there were only 2 of them that were still surviving. So science, unfortunately, has actually made very little progress in the treatment of ovarian cancer. There are very few, there's been very little progress made in curing this disease. And what I wanted to do is I wanted to ensure that no one ever gets ovarian cancer in the first place. So what is that? What did I just do? Yeah, it's both expansion and reversal, right? So I flipped it. I said, I'm not talking about treating it, I'm talking about preventing it. It was that medicine versus public health. And so what I did a bunch of reading about it, talked to a lot of clinician colleagues, people who are working in the field, and what I began to appreciate is that the cells that line the ovary are very similar to the cells that line the airways. And just like smoking causes inflammation, which causes mutagenesis and thereby lung cancer, I wondered whether that same pathway may occur in the etiology of ovarian cancer. So there was another tool in that. What's the tool? Analogy, right. Since then, we've actually been able to identify some inflammants that affect the pelvis, the pelvic cavity, and that may actually trigger ovarian cancer. We have some data to suggest that that's true. And there are ways to prevent those inflammants from ever, getting to the ovaries. So that's a great possible thing. And as well, colleagues from around the world have now started working on the notion that vaccines, which we normally think about as only in relationship to infectious disease, may actually be used to prevent ovarian cancer. So that's kind of a really wild idea, but there is actually a very active line of ongoing research in that direction. And I have to tell you that I came back from a conference that I was just at 2 weeks ago, and I was absolutely delighted to find that an international consortium that I work with, which really pools essentially all the epidemiologic data in the world on ovarian cancer, has now found that regular aspirin use may prevent ovarian cancer, and that was a hypothesis that I proposed long ago in putting forth this notion. And indeed, it may be the case. By the way, there was another tool in that too. What was that? Multidisciplinary groups. So that's really all that I wanted to tell you today, but I want to leave you with just two things to kind of as take-homes in terms of improving your innovative thinking skills. One is, when you're confronted with a new idea, think, what was the frame? Could I flip that frame? Could I change my point of view? Could I reverse it? Could I expand it? Is there some way to really think of it using a very different frame? And the second is simply the openness to new ideas. So when you were little, you may have taken out your crayons and you may have colored hair purple and grass orange. And I encourage you and your friends and your colleagues and your children to find your innovation muse. Find the joy in coloring outside the lines. Thank you. Should I take questions? Questions? Comments? Tomatoes? Anything?
I have a question.
All righty.
Any of your techniques, do you find one is better than the other, like the multidisciplinary?
That is that is a great question, and I just want to tell you, you get extra brownie points for that because no one has ever asked me that question. That is a surprising question. Very good. What I can tell you is, so I actually wrote I've written 2 other books after this one. One is a workbook that's got practice exercises, and the next one is a book in which I try to literally dissect the minds of scientific geniuses in the 20th century and ask, what tools did they use? And what I came away with in that one, which is not yet published, is that there seem to be some tools that are more commonly used, more universally used, and seem to be easier to use. So for instance, analogy seems to be a real easy tool. We all do it. We use analogies all the time. On the other hand, things like reversal are less common. Changing your point of view is maybe somewhere in the middle. So that does definitely seem to be the case. Good question. Yes?
I'm interested that you're teaching this at the level you are with adults.
Yes.
Is it not much too late?
Yes. It is much too late. No. Hopefully it's not. Some of my students are sitting on the front row. Is it much too late? I don't know.
Wait till our final.
So there's an interesting, observation that was made about different age groups and their creativity. So if you take these tests of creativity, and you administer them to kindergartners, and you look at folks that are, 2 standard deviations from the top 5%, okay? About 100% of kindergartners in the top 5%. Then you look at second graders, and maybe about 50% of them are in the top 5%. And then you look at high schoolers, and maybe 20% of them are in the top 5%. I told that to, that was as far as the experiment went, but I told that to Duke medical students, and one of them raised their hands and said, medical students are in the 0.5% of the top 5%. But the fact of the matter is, I don't know if it's a function of education and what our educational system does, or whether it's a function of age and social pressures, because, as I said, frame breaking is hard, and it's really socially non-normative. It really is, to say, gosh, everybody else is thinking that, and I'm going to think this. In fact, there's some great psychology experiments that show that people will follow the crowd even if they know that what they're doing is crazy, right? So I don't know what it is a function of, but the fact of the matter is we get less creative with age, we get less innovative with age, and it is in fact harder to teach adults to be innovative than it would be to teach children. And I would be so unbelievably delighted if these tools were actually used and integrated into our current K through 12 curricula, but as you know perfectly well, we are going in exactly the opposite direction. And that may be the reason why, the creativity crisis, that our students are getting less and less creative all the time.
May I just ask a follow-up?
Yeah, sure.
Do you know any place where these tools are being taught, or perhaps the question is really somewhere where students are being encouraged to continue to be creative as opposed to having it squashed?
There are a small number of examples. Probably the best example is Montessori schools. So Maria Montessori was one of the most unbelievably innovative and creative scientists, actually. She's thought of as an educator, but she was actually a scientist. She was a physician by training, of all times. And the Montessori schools continue to be very dedicated to open inquiry, curiosity, and I think it still goes on there. But obviously, most Montessori schools don't go up beyond the preschool level. There are very few that go up into the higher grades.
Some do.
Some do. Absolutely, some do. Yes, and I know that, and I'm actually talking with them about integrating this into their curriculum. Interestingly enough, that's right. Yes.
What do you think motivates people to be innovative? So I think you said a lot of the how, but what's the necessity is the mother of invention.
Absolutely.
Is that true?
It's absolutely true. And it's really interesting. There's so many idiosyncrasies about, there's so many things I want to say about that. I'm not sure where to start. There are a lot of idiosyncrasies about creativity and innovation. One of them is, so you would think, so how do we motivate people? It's all about the money, right? So my favorite joke is, the answer is money. Now, what's the question, right? But the fact of the matter is that it turns out, this is very odd, money is actually anti-innovative. So there have been a whole series of experiments done, from little kids all the way up through business people, that have shown that if you pay people for their outcome, for their productive outcome, it actually reduces their level of creativity. How odd is that, right? So the second thing is that there's some pretty good evidence that suggests that necessity is the mother of invention. And actually, if you create environments that are completely unstructured and barrierless, that actually doesn't help creativity either, all right? So, you put somebody in a blank room and you tell them, oh, go think. That actually doesn't work really, really well, oddly enough. You actually have to put some barriers in their way. It's interesting. So time barriers, place barriers, whatever they may be. So it is actually the case.
Because you started your talk by saying the big challenges that face us, global warming,
yeah,
a couple of things.
Sure, emerging infectious disease, yeah.
But which ones do people really, really feel are important and, as a society, agree? And I think cancer is the one that everyone jumps behind.
Right.
Are still under public debate.
Right. And the sad thing that I want to tell you about cancer is, 30 years into the war on cancer, actually, the progress that we've made, a lot of people think it's been spectacular. It actually turns out that life expectancy from many of the major cancers has not changed terribly much. We have made tremendous progress on selected cancers. Childhood cancers is a fantastic example, but for many of the common cancers, we really have made very limited progress despite 30 years and $100 billion investment. And I would say that that is definitely, for lack of thinking, really outside the box. Yes?
Do you think the current environment and system for research funding, reviewing grants and so forth, stifles innovation?
Oh my gosh. How many days do you have? We're not talking hours here. So the answer to that is yes. Let me count the ways. Let me talk about two ways. One is, so the system that so like all things things happen for a reason. Frames occur probably because of evolutionary pressure. There are probably incredibly good reasons why we have frames, because they grease our social interactions, right? I mean, there are really good reasons why you have expectations for people to behave certain ways and that people do behave those ways. In the system of scientific funding, we have peer review, and there are really good reasons why we have peer review. But nonetheless, what peer review means is that you get a bunch of old crotchety people who've been doing this for 20 or 30 years into a room. They have a lot of territory to protect. This is real. And some whippersnapper comes along and is going to do something disruptive. And that means that what I did for the last 20, 30 years is going to be wrong. All right? That's a real problem. Peer reviewers hate that. They just hate that. That just doesn't work well for them at all. So that's a problem. Second thing is that especially when dollars get short, as they are today, so NIH budgets, it's not exactly that they've shrunk a lot, it's that the competition has become so much greater. But what we call the pay line, so the, kind of the percentage of grants that actually get paid out has just plummeted. So particularly in situations like that, peer review panels get very, very conservative. And what that means is that they're unwilling to take risks. They want an absolute payoff. They want to make sure that this is feasible. Innovation is high risk, very high risk. I had a venture capital, a person who's a serial entrepreneur, big venture capitalist, come and visit yesterday and actually talk in my class on innovative thinking. And he was saying that basically venture capitalists will only fund about 1 out of every 100 proposals that they get. And out of those proposals that they are so selective to fund, maybe, if they're unbelievably lucky, 10 or 20% of them will actually make any profit at all. So this is a very high-risk game. It's a very high-risk game, so you have to be willing to risk-take. And science is quite loath to take risks, particularly today. So you asked a great question, but let's talk afterwards, and I'll tell you the other 30 reasons. Yes?
Would you talk a little bit more about when I believe you said frames are a set of expectations we use to interpret new information.
That was exactly what I said.
That it's both cognitive and emotional.
Yes.
Because to me, what we know can be counter to what we are feeling at the same time. Or we may be unaware of what we're really feeling.
Oh, yeah. Yeah, absolutely. Our frames are very, very frequently buried. In other words, I'm not saying that you're walking around all day going, oh, I expect this and I expect that. The vast majority of time, you're not thinking anything. I mean, you're completely unaware of what your frames are. And in fact, if I told you what some of your frames were, you wouldn't necessarily believe me right away. But I would tell you, well, that's how you're behaving, so that really is the frame that you're using. We use really huge frames in science, so very frequently we call these our paradigms, right? So Thomas Kuhn wrote a very, very famous book about paradigms in science and paradigm shifting and innovation. Some of our paradigms are, and just as one example, some of our frames are that science is progress. Science is progress. Science has to move forward, right? That's a frame. Actually, oddly enough, I would say that there are elements of that again, that are great and important, as all these things are, but there are elements of that are actually anti-innovative, because innovation frequently moves backwards and sideways and up and down, but often backwards. So there's a phenomenon called re-engineering that some of you may be familiar with, and that's really backwards movement, right? So you got to be willing to do anything when it comes to innovation. So this notion that we always have to move forward and we always have to be making progress means that if you're sitting in your office contemplating your navel, which may actually mean that you're thinking, we don't value that very much these days in science. Yes?
Would you talk a little more about, you said groups can be smarter than individuals. I'm interested to hear that E.O. Wilson was here a few days ago.
Wow.
Talking about
sorry, I missed him.
Group selection, the group as an evolutionary organism from the standpoint of evolutionary biology, and the idea of group intelligence and so on. Do you talk about that in the book?
Mm-hmm.
And could you talk more about the dynamics of group function, which has resonance with what E.O. Wilson said?
Yeah, absolutely. And there's also a really interesting book called Crowdsourcing. So if you're interested in this topic, Crowdsourcing is a great book for you to read, which is all about exactly this. So yeah, I mean, basically, groups, I mean, when groups work well together, they basically work at the interface between what one person knows and what another person knows, right? So, so two people can both be very, very smart, but their knowledge bases can be very, very different. And when you can bring that together and create this dialogue, then the two of them together are smarter than either one of them was separately. I think the other thing too, I mean, there are lots and lots of ways in which groups can be smart and innovative. Another way in which they can be smart and innovative is when they question each other, right? So again, you know, I have a set of expectations about something, and somebody else who's smart comes along and says, well, why is that your expectation? And then that's really the first time that I even realized I had that expectation, right? So groups can be smart in that way too. There are lots of different ways they can be smart. There's a whole chapter in the book on this, but Crowdsourcing is another good book to read. Yes, in the back.
It would seem that curiosity would contribute to frame breaking and therefore possibly
absolutely
data that confirms that.
Absolutely, yeah, great question. So curiosity. So one of the first things that I asked my students when I walked into my class this semester is, what are you curious about? That is a fundamental in innovative thinking. You have to be curious. If you're not curious, you're not going to think innovatively, you're not going to think creatively. And so, you know, it's really fascinating when you start becoming more curious. I'll give you a homework assignment, actually. The next time that you're in an airplane, think about all the things that you could be curious about. You know, so how do airplanes create lift? Why do clouds have edges? What's going to be the end of the movie? That's actually the one that we usually think about. But, you know, there are lots and lots and lots of things. When you start making lists of all the things that you could be curious about, it's kind of unbelievable. And children ask 100 questions a day on average. Children are unbelievably curious, and that's probably the reason why they're so creative. They don't know any bounds. Yes.
So so kind of in a political framework, we have, it seems to be kind of a polar situation. We have this very clear Occupy movement, and we have these kind of entrenched positions about social policy, nothing else, in political and economic policy. And so it speaks to, in my way, partly, I mean, it's not like there wasn't a group that wants to go back and do the fundamental work, called the Tea Party, that may be one variation of that theme. And the Occupy movement is a kind of a newer version in some ways of that. We used to call it populism, I think, before that. And I'm just kind of wondering what gets in the way. They both think they're thinking new things.
Yeah.
And so,
are you saying what gets in the way of the
curiosity kind of
dialogue between polar?
Where curiosity gets, you know, kind of encouraged in one set of people and discouraged in another, if that's what's going on.
Well, I think I would put it in a slightly different way. So let me just actually be clear about one thing, and I should have said this before. This notion of frames is not my idea. My idea is to apply it to innovation, but the notion of frames actually originally comes from linguistics. It comes from the field of linguistics, and then it's been applied throughout the social sciences and including to politics. Frames have been frequently applied to political thought. And I think that the dichotomy, the polarization that we see in American society in part is really a phenomenon of the emotionality of frames, all right? People have these expectations, they have these assumptions, they have these belief systems that they're frequently not even aware of, but yet they are highly emotional, highly emotional. And so I think very frequently when we think we're having a logical dialogue between people of different political parties, we're not at all having any logic or dialogue. What we're having is we're having a clash of kind of emotional ideologies. And we can't get past that. We can't get past that incredibly emotional construction and entrenchment. And I mean, I think that that's just kind of an enormous problem. If we could get people to even understand what they were doing, it would be a useful construction.
Could you just a second word about how do you encourage versus discourage curiosity? Because clearly that happens in some places and not in others. That's
right. That's true. I think the way to encourage curiosity is to really show people how joyful it can be. I mean, science is joyful. In fact, there's a chapter in here called The Joy of Science. And curiosity is joyful, and creating things is joyful, and building things, and inventing, and doing all those things is joyful. And most people do those things in some aspect of their life, and they have this curiosity, but they may not even appreciate it as such. So some of it is a matter of just pointing out to them that that's really what they're already doing, and really that they can expand it. So I think we're done, right? Okay, thank you.
Not quite for the entire reading. Thank you so much,
sure.
Roberta.
My pleasure.
This was a tremendous discussion of the book.
Thanks.
Please join us out in the Commons. Dr. Ness is going to be available to sign her book, and there are, if you haven't purchased the book already, there are copies of it out there to purchase, and we've got a reception. So you're welcome to stay and join us. Thank you.